Hello everyone. Artificial intelligence, AI, is rapidly reshaping healthcare, offering unprecedented capabilities in disease detection, personalized treatment, operational efficiency, and patient monitoring. From AI-powered imaging and predictive analytics to virtual assistants and robotic surgery, these technologies are redefining how clinicians deliver care and patients experience it. However, as AI becomes deeply integrated into healthcare systems, it also raises critical questions around trust, ethics, equity, and accountability. To ensure AI strengthens rather than compromises healthcare's human-centered mission, a structured approach is essential. The HEAL framework, human-centered, ethical, accessible, and legal, provides a blueprint for responsible and agentic healthcare, guiding the development and deployment of AI tools that empower clinicians, protect patients, and ensure fairness across all levels of care. This presentation outlines AI's transformative role in healthcare and introduces the HEAL framework, human-centered, ethical, accessible, and legal, as a guide for responsible adoption. We explore each principle, highlight opportunities for enhanced precision and patient-focused care, and discuss challenges such as privacy risks and over-reliance on AI. Finally, we consider the future, showing how HEAL integration can ensure ethical, resilient, and collaborative AI-driven healthcare. AI transforming healthcare. Diagnosis. AI-powered imaging, predictive analytics, and decision support systems enhance accuracy in detecting diseases, for example, cancer, cardiovascular issues. Treatment. Personalized medicine, AI-driven drug discovery, and robotic-assisted surgeries improve treatment outcomes. Operations. Streamlined hospital workflows, optimized resource allocation, and predictive patient monitoring reduce costs and improve efficiency. Need for responsible adoption to ensure trust. Ethical concerns. Potential bias in datasets leading to unequal healthcare outcomes. Data privacy and security. Handling sensitive patient information requires strict safeguards. Transparency and explainability. Clinicians and patients must understand AI-driven decisions. Accountability. Clear frameworks are needed to define who is responsible when AI makes or supports a medical decision. HEAL framework overview. Human-centered, focuses on AI as a support tool rather than a replacement for medical professionals. Prioritizes clinician empowerment by providing decision support, reducing administrative burden, and enabling faster, more accurate care. Maintains the patient-clinician relationship as central to healthcare delivery, ensuring empathy, trust, and human judgment remain integral. Encourages co-design of AI systems with input from healthcare workers, patients, and caregivers to ensure solutions fit real-world needs. Ethical. Embeds fairness to avoid biases that could harm underrepresented groups. Promotes transparency in AI processes, making models interpretable for clinicians and understandable for patients. Enforces accountability so that roles and responsibilities are clearly defined when AI systems influence clinical decisions. Encourages ethical governance structures, such as AI ethics committees, to oversee deployment and ensure societal trust. Accessible. Strives for equitable access to AI innovations across urban, rural, and underserved populations. Addresses digital divide issues by ensuring necessary infrastructure, training, and resources are available. Advocates for cost-effective solutions so that AI adoption does not widen disparities in healthcare delivery. Supports multilingual and culturally relevant AI tools to serve diverse patient populations effectively. Legal. Ensures AI systems comply with healthcare regulations, for example, HIPAA, GDPR, PDPA, for patient data privacy and security. Aligns AI deployment with medical device regulations and safety standards before clinical use. Establishes clear liability frameworks to determine responsibility in cases of AI-related errors or harm. Promotes policy alignment and international collaboration for AI governance, fostering safe global healthcare innovation. AI as co-pilot in healthcare. AI acts as a co-pilot for clinicians, augmenting decision support rather than replacing them. In diagnostics, AI analyzes health records and lab results to detect early disease signs and suggest interventions. AI tools assist radiologists in medical imaging by rapidly identifying anomalies in X-rays, CT scans, and MRIs, improving accuracy and efficiency. Examples include Google DeepMind's breast cancer detection system and AEQUITAS platform for real-time critical case triage. AI is also transforming triage through intelligent systems that assess symptoms and guide patient care. Benefits of AI include time savings through task automation, for example, image analysis, documentation, and highlighting overlooked risks or treatment options. Clinicians retain control as AI outputs are decision support, not final authority. Healthcare providers utilize clinical judgment, empathy, and contextual understanding that AI cannot replicate. Medical professionals remain accountable for diagnosis and treatment decisions, ensuring ethical and legal responsibility. In short, AI serves as a trusted co-pilot for physicians. It provides data-driven insights to empower doctors. The AI respects the clinician's expertise, experience, and ultimate responsibility for patient care. AI is significantly advancing healthcare diagnostics by enhancing accuracy, reducing workload, and speeding up critical decision-making. In breast cancer imaging, AI models have reduced false positives by 5.7% in US, and 1.2% in UK, and false negatives by 9.4% in US, and 2.7% in UK, while improving AUC scores by 11.5% and reducing second reader workloads by 88%. Similarly, radiologists assisted by AI improved the diagnostic sensitivity from 75.3% to 84.8%, with AI alone achieving 88.8% sensitivity. In critical care, AEQUITAS AI triage tool for intracranial hemorrhage demonstrated 96.2% sensitivity and 93.3% specificity, cutting turnaround times from 132 to 73 minutes. Stroke triage systems now diagnose cases over an hour faster, raising full recovery rates from 16% to 48%. Beyond imaging, AI tools are driving innovation in frontline care. A novel AI-powered stethoscope can diagnose heart failure, atrial fibrillation, and valve disease in just 15 seconds, making conditions 2 to 3 times more likely to be accurately identified. In ophthalmology, AI systems achieve approximately 92% accuracy in glaucoma detection with 91.36% sensitivity and 94.12% specificity, offering cost-effective screening options for underserved areas. Collectively, these advancements show AI potential as a powerful co-pilot, improving precision, reducing delays, and expanding access to quality diagnostics. Medical AI systems are only as fair and accurate as the data on which they are trained. If training datasets overrepresent certain demographics, for example, age, ethnicity, gender, or come from a limited geographic region, AI models risk producing biased results that may misdiagnose or underserve underrepresented groups. To avoid bias, healthcare organizations must ensure diverse, representative datasets, apply bias detection techniques, and continuously monitor performance across patient populations to safeguard equitable care delivery. Bridging the digital divide in healthcare means ensuring that patients in rural and underserved areas have the same access to quality care as those in urban centers. Many remote regions face barriers such as limited internet connectivity, fewer medical specialists, and scarce diagnostic equipment. AI-powered telemedicine platforms, portable diagnostic devices, and offline-capable health apps help close this gap by enabling early detection and timely treatment even in areas with minimal infrastructure. For example, AI-driven stroke triage systems in the UK have cut diagnosis time by over an hour, improving recovery rates, while smartphone-based glaucoma screening tools have achieved over 90% accuracy, offering affordable eye care in low-resource regions. Affordable AI solutions are critical to achieving global health equity. Low-cost, scalable tools, such as AI-powered stethoscopes that can detect heart failure or arrhythmias in just 15 seconds, and cloud-based decision support systems that guide clinicians in remote clinics, can deliver advanced care without overwhelming budgets. These innovations demonstrate how AI can make high-quality healthcare accessible to underserved communities, helping global health systems move closer to equity goals, where location and income no longer determine the quality of care received. Legal and governance considerations. First, data protection, HIPAA, GDPR, APAC laws. AI in healthcare must comply with strict privacy laws. HIPAA, US, GDPR, EU, and APAC regulations, for example Malaysia's PDPA, Singapore's PDPA. Focuses on consent, encryption, anonymization, and secure health data handling to maintain trust. Second, clarifying responsibility for AI-driven decisions. Clinicians remain final decision makers, but AI developers and institutions share accountability. Audit trails, documentation, and governance policies define liability in AI-supported care. Third, regulatory approval, FDA and others. AI medical tools require regulatory clearance, FDA in the US, EMA in Europe, PMDA in Japan. Examples: ADOC AI for stroke triage, IDX Drive for diabetic retinopathy. AI devices approved for safe, clinical use. Opportunities with HEAL. Improved accuracy and dependability in healthcare. AI facilitates precise diagnostics, early disease identification, and refined treatment strategies by scrutinizing extensive datasets, minimizing human error, and enhancing clinical decision-making. Tailored and patient-centric healthcare. Personalized medicine utilizes AI to customize therapies and care plans for individual patients according to their genetics, history, and lifestyle, leading to improved outcomes and enhanced patient satisfaction. Dependable and credible deployment of Agentic AI. Agentic AI systems in hospitals must be visible, evaluated, and controlled to ensure the safe automation of jobs, for example, monitoring, triage, while assisting, rather than replacing, healthcare workers. Challenges and risk. Dependence excessive on artificial intelligence. Excessive dependence on AI technologies may impair clinicians' critical thinking and diagnostic abilities, diminishing their capacity to make solid judgments independently of technology assistance. Risks to privacy and cybersecurity. Sensitive health information is susceptible to breaches, hacking, and misuse, necessitating stringent security measures and data protection standards. Requirement for ongoing assessment. AI models necessitate continuous oversight, validation, and upgrades to maintain accuracy, reliability, and ethical adherence as medical procedures and data progress. For the future, incorporating HEAL into AI design and execution. Incorporating the HEAL principles, human-centered, ethical, accessible, and legal, at every phase of AI development guarantees ethical and reliable healthcare solutions. Cooperation among stakeholders, healthcare professionals, artificial intelligence developers, lawmakers, and regulators must collaborate to establish secure, efficient, and user-centric solutions that meet genuine clinical requirements. Healthcare that is prepared for the future and guided by ethical principles. Aligning AI with ethical principles and human oversight enhances healthcare's innovation, equity, and resilience, preparing it to address the changing requirements of patients and society. Finally, we are at the end of the presentation. By embracing AI responsibly through the HEAL framework, we can revolutionize healthcare into a system that is more intelligent, accessible, and compassionate. Let us prioritize ethics, empower healthcare professionals, and guarantee that every patient benefits from the advantages of innovation. We can together construct a world where technology and compassionate humanity work together healthily. We encourage to collaborate for present and future work. Thank you.